The next question in the panel addressed what are some of the most effective strategies for getting families involved in the treatment process? And I readily admit up front that most of my background is in education. And so I want to talk about treatment interventions from the perspective of being an educator. I'll touch on clinical interventions. Most of the responses that day, there were 3 other members of the panel, and these are all clinicians that are clinical directors of treatment facilities, and so they address more of the clinical. And so if I can just kind of position what I want to say more from the angle of education, particularly in the context of being here at Cal Southern University. Part of the material that I've been working on in the last couple of years and have begun to include throughout our addiction studies certificate is that there are barriers to treatment. Just because somebody has hit bottom with their addiction doesn't mean automatically, doesn't mean that they're going to enter therapy. In fact, there are all kinds of barriers that keep most people that hit bottom from even acknowledging that they have an addiction, much less getting treatment. And the 2 psychological barriers that I've identified from my research that are the 2 most forbidding, they're the most powerful barriers to people coming to treatment, are kind of 2 sides of a coin, personal shame and cultural stigma. And it's shame that keeps me from admitting to you that I'm an alcoholic or that I'm addicted to drugs. And it's cultural stigma that I've internalized that adds to my shame. I don't know, I may not even know what the cultural values are around addiction until I run into it, and all I know is to talk about it certainly isn't going to up your respect for me, chances are. My interest is in bringing this to the families, and in the context of a panel that was addressing family dynamics in the treatment of addiction. I think that there's the most leverage around educating people about shame and stigma, and I'll say a little bit about that in a minute, is in the family. I feel like that if you can educate families, that's a good start. I don't think it makes sense. I mean, it's idealistic to think, well, we're going to change national mores around addiction anytime soon. But I think you can start on an individual, family-to-family basis, and just in terms of where traction is, if the family can admit to itself that there's a problem, which is no mean feat, and provides some safe place, some kind of zone of security where the addict can admit to addiction without feeling like that they're being judged, blamed, reduced down to being somehow defective, that's a beginning to address this. My own view about education is that even though shame and stigma are psychological or emotional reactions to feeling like I've somehow been ostracized, either I'm being rejected by you for being bad or morally deficient, I may be doing that to myself, or my subculture or culture does that to me, is that I think that these emotions can be very powerfully addressed by bringing in information, and this is where the educator in me comes out. If you can help somebody to understand the process of addiction in a very kind of clear-eyed, straightforward, scientifically based way, my experience, both personally as well as clinically, is that it can be very, very effective in reducing shame and stigma. Let me talk about it personally for a moment. I began reading in the neurobiology of addiction a couple of years ago, with quite a bit of fervor. And what I discovered is that I thought that I didn't have much judgment about addiction. I work with people that are in recovery and have done so for years. There's no time in which I haven't done that. 1 out of every 2 patients that comes to psychotherapy is addicted. This is the latest statistic from the Substance Abuse and Mental Health Services Administration, which is shocking. So that, though I have to tell you that in graduate school, I didn't have a course in substance abuse. I had 1 lecture in substance abuse. I find it ironic that I got out of graduate school with 1 lecture on substance abuse and treatment, and half of my clients coming in, at least, were or are addicted. So I've had to work over the years at kind of righting that imbalance. In the process of studying addiction, especially in the last few years, even though if you'd asked me a few years ago, did I have any kind of judgment or revulsion or any kind of reaction to a client coming with addiction, I probably would have said very little, if any. As I began to study into the science of addiction, what came clear to me is that I did have, in other words, the information revealed to me by contrast, little nooks and crannies in my psyche that wasn't so sure about addiction. As the more I've studied, it feels like it's almost completely cleared out those negative biases. And so it's generalized from that for me, then bringing that education to clients I see, bringing that to students, people that I supervise, and the feedback has been universal. I'll speak about it most intimately in terms of the recovery coaching that I do. Any client that I help educate around addiction, and many, if not most of my clients, struggle with addiction, either themselves or within their family, virtually all of them express relief for the information. And what it does is that the more information just directly reduces some of these very deeply ingrained negative prejudices against addiction. So my sense of it in terms of effective strategies for family treatment is one of them is just, can we just start with some good information? So to educate, I think, is really important. I don't think that that's all of therapy, but I think it's a good place to start, is just by educating the individual and families about addiction. I want to give you some examples of how that's also been borne out outside of my own direct clinical experience. Just in the last few weeks, I was had a chance to go to UCLA-sponsored what was called Recovery Day for Families. And it was the maiden voyage of a new organization called the Los Angeles Recovery Network, which has been instituted to address bringing together professionals, mental health professionals, medical professionals. It was the medical school at UCLA that sponsored this. So there were board-certified addictionologists standing up in the auditorium in front, speaking to some combination of professionals like me and family members and addicts in recovery, which I thought was amazing. To begin to talk about what I just said, which is to educate, begin to educate about what's going on in addiction and how that information can be kind of an effective antidote to biases, prejudices, shame, stigma. It was interesting, one of the presenters I remember well was a young physician who had graduated from, I won't name the medical school, but graduated from a medical school recently. And this is 30 years later, and he said the same thing I just said, which is that he went all the way through medical school. He's going to be prescribing pain medications, for example, as a practitioner, guaranteed he'll be prescribing opiates. And he said that he didn't have a course on addiction. He had one lecture on addiction. And he's set about, as one of his missions, is to right that particular gap in education at UCLA, which I commend him for. And so he was bringing that information to the family members to say that just because you go see a doctor, most doctors are not charlatans, most doctors are not evil, some are. I just talked to a physician a couple weeks ago who verified that there are some doctors that are just really bad news. They're bad doctors, in his words. Most doctors are not that, but most doctors are ignorant of addiction, and so the prescribed medications, particularly the opiates, 3 times more overdose deaths in the last year owing to prescription medications than just 10 years ago. That's a national statistic. The Center for Disease Control just published that. 3 times more overdose deaths, most of which are owing to, most addiction to opiates is not heroin. 75% of addiction is to prescription medications. 25% are to heroin and other derivatives, morphine, codeine, and so on. But most of these are prescription medications. The big ones that you hear about, like OxyContin, is a major addiction with that. People die all the time with that. They die before they get addicted. They take it, they combine it with alcohol or some stimulant like cocaine, and they die. And so it's a major problem in it. And so maybe I should say you not only educate families, but you educate professionals. It seems to me it's really incumbent upon us to do that. A couple of points clinically. I mentioned Burr Cook, who's the family interventionist based out of Tennessee. And I mentioned the resource that he has, familyinterventionsnow.com. What Burr told us, the professionals that were gathered together in his presentation, is that he gets families involved right from the very beginning, is that you may send a son or daughter off to a rehab facility, either locally or across the country, but immediately the family's in its own forms of therapy. You begin to get them involved in healthful living practices, like I mentioned earlier with the integral life practice, is that there's no point at which the families aren't part of the treatment. That's what he meant by that when he said, if you do not enter into recovery, your son or daughter will die. Recovery means the whole family enters into treatment because the whole family needs to transform. So right from the very beginning, he's involved in that. I also talked about the book Integral Recovery. John Dupuy has worked in wilderness recovery for years, and he and I have spoken at length about this, and he does the very same thing. He gets families involved right from the beginning. He has them read articles, read his book. He has them view videos. One of the best videos, I want to recommend it, is by the addictionologist Kevin McCauley. He's a MD, lives in Utah. John Dupuy lives in Utah as well. They know one another, and the video is entitled Pleasure Unwoven, and you wouldn't know from the title. He just knocks it out of the park in terms of providing information that's really critical to understanding addiction about very technical topics in a non-technical language. It's just really masterful. It's the best thing that I've seen. Pleasure Unwoven. It's available as a DVD. You can order it online, either from him or through Amazon or whatever. As I mentioned, John Dupuy requires that families view videos of this nature. Another fantastic video series was put out by HBO in 2012, just simply called Addiction, and it's absolutely incredible. They bring in everybody who's a major figure in addiction in the U.S., and again, they're speaking to lay people, so it's really easily understood by family members. So to take a very aggressive educational tactic is what John does. And also gets families involved in all those 8 practices I just talked about earlier. And then I also mentioned the center. It's called Well-Minded Center here in Irvine, that involves families in nutritional counseling. In terms of continuing care, the idea is that you provide all kinds of services for the entire family. So that includes Al-Anon meetings, Alateen meetings, there are AA meetings, there are nutritional counseling meetings, they have multiple family groups that meet, and this is more and more common, where you have family therapy with a family, but you also bring in multiple families. You can imagine how useful that would be, to compare notes with family A, compares their experience with family B, and they learn from one another. One of the gurus of group therapy is Irvin Yalom, and he says that one of the primary healing factors of groups like a multiple group therapy is, he calls it universality, just the fact that we're in this together and I can learn from you. It reduces, a further way of reducing stigma is that, oh my gosh, your experience is the same as mine, and plus I can take notes as you talk about things that have worked for you. So those are some of the strategies.